We're going to spend about 40 minutes presenting and then have questions at the end. So thank you, first of all, for choosing to attend this webinar because it is a mission critical issue. And we're going to talk about why and how and what some results, some study results show these days, and also what can be done moving forward regarding improving correction staff wellness. I'm Caterina Spinaris with Desert Waters Correctional Outreach. So we're going to be framing our presentation today around ACA's 2017 resolution on correction staff wellness. The American Correctional Association in January of 2017 put together this resolution, and I approved it, and it's part of the resolutions now for ACA. So the first statement is that correctional employees' wellness is a critical issue that has reached crisis proportions, and I would venture to say that yes, it has reached crisis proportions, probably because of several factors, but definitely one thing that we've seen over and over is the short staffing in various jurisdictions that causes the need for a lot of mandatory overtime, which accelerates a lot of issues regarding wellness. So let's go over some, in great summary, in a very, very much in a nutshell, what some things we know about research findings, and we have references at the end of the presentation. I'm not going to be going over references in detail here. I'm just going to give you the global overall version of findings. And ACA's resolution states that the unique inherent risks that corrections employees are exposed to have resulted in increased health risks. So what I wanted to do here is talk about what we know regarding the unique inherent risks of corrections work. And this covers both custody and non-custody staff, security and non-security. So it's primarily corrections officers, but not exclusively. It also applies to like correctional nurses, teachers, program people in general, program staff or maintenance, everybody working in a corrections environment. And these inherent risks result in increased health risks. And so let's see what are some inherent risks. Some of the challenges of corrections work that are built in, inescapable. The first one is that staff are exposed to violence, injury, or death on a pretty regular basis, repetitively, sometimes more than one incident occurring at the same time. So they have this background of threats of violence, injury, or death, or the actual events of violence, injury, or death. And that exposure to those events is either direct or indirect. Either the staff are witnessing those events in real time themselves, they witness them or they have them happen to them, or they read about them and hear about them, learn about them later on, not in real time. They're also exposed to harsh physical conditions, like very, very cold, very, very hot environments, a lot of gray, and we're talking about institutions primarily here now. The work overload, where staff are tasked with several tasks and they have to keep up, and sometimes they don't even sit throughout their shift. They're always running back and forth, needing to work overtime, sometimes multiple times a week for months on end. And then the organizational structure and climate research has shown that sometimes there is a sense of disconnect between line staff and administration. Issues of input are limited. Communication sometimes is limited. So that contributes to the inherent work challenges. ACA acknowledged in its resolution that very, very few resources have been used on researching this topic of correctional employees' wellness, and very few resources have been used to provide tools to improve corrections employees' wellness. In a sense, this topic has been not in the forefront, and so there are major gaps in what we know and what has been known through research so far, but we're headed in the right direction. There is a lot more done. I like to think back when we first started the Desert Waters in 2003 versus today, huge differences, great improvements, a lot more done and acknowledged and implemented for corrections employee wellness, but still a lot more needs to be done. And we have additional inherent work challenges. The occupational stressors in a nutshell. I like to use that frame of reference here. It's a summary, a way to look at things in summary. That we have traumatic stressors, like I talked about before, direct or indirect exposure to trauma. We have operational stressors that come with having to run a 24/7 operation. And even in probation and parole, staff may be called at 3 o'clock in the morning when a parolee or probationer has been arrested or an incident has occurred. We have the issues of staffing. We have the issues of equipment, working or not working, being available or not being available, locks on doors, all kinds of things that happen at the operational level. And then organizational factors are the people factor. The operational are the equipment and technical factors, and the organizational are the interpersonal factors, such as personality conflicts with coworkers, or friction with administration or supervisors, or friction with offenders. It could be the way that people perceive how promotions are done, or how evaluations are done, or how disciplinary hearings are conducted for staff, investigations. All those things contribute to the organizational stressors of the job. And back in 2000, I came up with the term corrections fatigue to indicate the sum total of all those stressors working together and impacting staff, because it's really hard to separate these contributions, the relative contributions of trauma versus operational factors versus organizational factors. They're all co-occurring and occurring repeatedly, and it's really hard to separate what contributes to what. So altogether, I came up with an umbrella term of corrections fatigue to kind of capture all those three and their outcomes at one glance. And these stressors occur in the context of people really not understanding what is happening sometimes, like family and friends on the outside or outside of corrections work or outside of law enforcement do not really comprehend what is happening, how their loved one is changing, and why. The supervisor sometimes might think that somebody has a work ethic problem, but in fact they may be really losing ground because they're overly stressed and overwhelmed. The employers might have, wondering why their staff is disengaged and they are trying to not show up at work and calling sick all the time. And even themselves, they may not understand what is happening, how they're changing, what is going on. They don't have a roadmap. And in addition to that, we have a culture of toughness, a very pervasive attitude that, hey, suck it up, get over it. You signed up for the job, you knew what to expect, just keep going. And don't let anything affect you, and don't act like you're weak, because we'll ostracize you if you act like you're weak and you break down. So people don't feel free to share the fact that they're struggling, and all that contributes to problems and needs going unheeded and being neglected for a long time. And by the time they come up to the surface, they may be really, really pervasive and very severe. Whereas if they had caught them a little earlier, they would have been a lot easier to handle and manage. And on top of that, we have also the negative public image where there is no glory, so to speak, in doing corrections work. A lot of times people stereotype corrections personnel as brutal and uncaring or corrupt. And so there is no satisfaction in a lot of ways from the outside, getting any kudos for doing this kind of work. So this is the context that people find themselves dealing with different situations that come up at work. Basically, not a lot of support. And we know that support is huge to mental health and wellness, good support. So the resolution goes on to say that the nature of the correctional environment can be a causative factor in high-risk behaviors, such as the abuse of alcohol, prescription medications, and illegal substance use. So the nature of the correctional environment can be a causative factor in high-risk behaviors. So they're saying, basically with this clause here, that there is a cause and effect here, that what staff are immersed in and saturated with and exposed to on a regular basis ends up causing malfunction or disease. And in this case, they're alluding to, not alluding, the fact that people are trying to cope by using basically avoidance techniques such as substance use. And of course, we know that staff get injured, especially corrections officers get injured a lot in maybe uses of force or being attacked by offenders. So they have to have surgeries, and they get put on prescription, pain medication, so then they can get maybe addicted to opioids and opiates because they are prescribed those medications, and the vicious cycle goes on. So to me, that was a very, very important thing, that it was acknowledged that there's a causation here, that the exposure to different types of stressors on the job ends up taking its toll. But eventually people start showing signs of malfunction and poor health and deterioration, because in this case, of the way they try to cope with them, becoming self-destructive behaviors to try to get through the day or the week. And also, it stated that the traumatic events in a correctional environment may lead to employees experiencing post-traumatic stress disorder. And that's important because we know that staff are not exposed to one or two incidents in their career. They're exposed to dozens of them, and in very different types and different severity degrees, and the direct and indirect exposure both occur. So it's a saturation again, and I think most people, unless they have incredibly good coping skills, but most people would show some wear and tear as a result of that, just because it's so much of it. It's cumulative. It's years worth, decades worth of exposure. And research has shown, and I'm not referring to the studies here, but they're at the end of the slides. Research has found that corrections officers in particular have issues with hypertension, being overweight or obese, anxiety issues, depression, PTSD, post-traumatic stress disorder, substance use disorders, we mentioned it earlier, work-family conflict that can be more pronounced than work conflict, and definitely an elevated suicide risk compared to other populations, including law enforcement populations. Like one study in New Jersey found that the corrections officers had twice the rate of suicide than police officers. And they didn't expect to find that, and they were shocked, and they were surprised. And to me, it wasn't a surprise, because we have seen how much more they're exposed to very negative events than police officers tend to be. So these are all documented, in various studies, that these rates are noticeable. These are not, these are the significant amounts of these disorders. And so obviously it's going to affect how people function if they're having to deal with all those pretty serious conditions. And I dare to say, I mean, all of you listening right now, I'm sure you can run through your mind and, names and faces of people you've known that decided to end their stress by killing themselves. And it's a very, very sad situation, and it's way too prevalent, and more needs to be done regarding supporting staff so they don't opt for that very destructive choice. And so why do we want to have wellness programs? Because if we don't have a lot of good stuff. I mean, work engagement goes downhill. I remember somebody telling me, like an administrator, that he said, my staff, whatever they can do to not be at work, they'll do it. Lack of engagement, work performance suffers, and we know that. People will cut corners. People will forget if they're dealing with depression, post-traumatic stress, alcohol use. Their brain is not going to be working right. They may forget something. They may make a mistake in judgment. Safety and security get affected. Retention is a huge issue with a lot of turnover across the nation, or with people disengaging, and they're not gone, but they're gone. They're not, we call them retired on duty, ROD, or they do lateral transfers out of certain facilities. The disciplinaries will be higher if we don't pursue wellness, because people are going to have a hair trigger temper. They're likely to blow up at somebody. That's one of the PTSD traits, that anxiety and agitation and arousal. So they may have an anger outburst that gets them in trouble. Then they're written up, investigated, disciplined, and then other things could happen as a result of that. And then, of course, poor choices let's say, in use of force, making departments liable, and because of litigation issues. So these are some reasons, and there are more. We want a healthier culture, because if we don't have staff that are well, the culture suffers. The culture is unhealthy, and so you have people coming to the facility or to the agency from the training academy, all excited, ready to go, ready to change the world, so to speak. And they walk into a facility and they get hit with the negativity, the depression, the cynicism, and that is a big bubble bursting moment for them. Of course, sick calls are an issue. FMLA use is a big issue, and workers' comp due to injuries on the job, healthcare costs going up. And really, we need to pursue self-wellness because it's the right thing to do, because the environment is such, inescapably so in some ways, but not in all ways, that people get affected. And it's, of course, it's a violent type of occupation when you have to hold people in that don't want to be in, or keep them accountable that don't want to be maybe held accountable. And these are maybe the unavoidable stresses of the job. But the avoidable ones that I'd like to focus on a lot is how people treat each other, how staff treat other staff, how teams work, because these are avoidable stressors, and people can pursue wellness along these lines and hopefully reduce some of the impact of the unavoidable stressors. And I'm going to talk very briefly here about basics for solutions. Before that, I want to mention that, let me go back as we review a little bit of this, that those occupational stressors and the corrections fatigue situation leads to various changes in staff, where they start changing as a human being. I mean, people say, you change, you're not the same person I used to know, you're not the person I married. The personality changes, where they have a lot more, let's say, a social, gregarious, outgoing person may become reclusive and not like people anymore. And somebody who used to be calm and peaceful may be really irritable, have a very short fuse. These are some changes in personality. Then the health and functioning, we talked about the physical health with the weight gain, blood pressure issues, cardiovascular issues in general. Then the psychological health with depression or anxiety or panic disorder or PTSD. And then people's core beliefs change and their behaviors. So they start functioning differently and acting differently and doing things and saying things that before they joined corrections they would have never imagined saying or doing. And we talk about the humanization of offenders, where people, to separate themselves and be able to continue coping and going back in the next day to work in that environment, they would minimize and act like they don't care about anything. And the way they would treat somebody would be appalling. And they probably would have never imagined that they would do that before corrections work had started. So there are all those changes at work where they impact each other. So one staff rub off another staff member and kind of contaminate them with that attitude. And then if enough of them have these issues, then the whole workplace culture starts looking and acting like that. And then people take things home. They go home and their family members say, whoa, like, don't talk to us like we're inmates, or what's the matter with you? Are you heartless? Where is your compassion? Where is your empathy? Where is your mercy? And people, to be able to continue at work dealing with all kinds of traumatic incidents and conflicts, they have shut down and they don't feel any of those things anymore. So that can cause problems at home where communication gets more and more reduced, and it becomes very artificial, and then in the end, people may become strangers, and the home life suffers all the way to possibly divorce and or even physical conflict, and people lose their only social support system that they have left, and that, I believe, makes them very vulnerable for suicide when they are in that place of having no one to turn to for support and to refuel. So, okay, so let's go forward. As we, and I'm sure you know a lot of that that we talked about so far. So as far as solutions, what can we do? ACA states that it urges correctional agencies to raise awareness. So that's point one, raise awareness, increase awareness, and educate employees regarding employee wellness in a corrections environment, including emphasis on employment-related stress. So education is step one, making people aware, understand. One of the things that we do that is very impactful on staff is we do a certain exercise in one of our trainings where people find out that they're not the only one who's having those issues, because usually people are tight-lipped. They will, because of the macho, tough culture, they won't talk to each other about their struggles, and they think they're the only one experiencing those struggles. And they don't realize that those struggles are very universal, and more or less, everybody experiences them to some degree. And so when they realize that, whoa, it's not only me, it's a huge weight lifted off of them, and the shame gets reduced or goes away completely. And so we need to raise awareness, educate, equip people, as we're going to talk about, with ways to cope, and also provide the means for a healthier environment. So kind of using some simple analogies, I'm saying that we need things like a toolbox. People need to have techniques, ways to process what they're exposed to, what to deal with, and to cope with what they're experiencing. So they have means to deal with them instead of just drinking or whatever else it might be that they're doing, some other addictive acting out behavior. Have a hazmat suit, some kind of protective gear, so to speak, for their mind about what they're seeing, some kind of inoculation, vaccination training, so that they have some kind of protection when they're around mayhem or when they're around severe trauma. And then we need like a hospital, a clinic, where people can go get treated once they get wounded. And I'm talking here psychologically primarily. And so the first two are prevention, the toolbox and the hazmat suit are preventative. But the hospital is for those who are affected and they know it. How can they go get help and get better so they can bounce back and come back to work and function in their personal lives? And the ACA resolution goes on to say that the American Correctional Association encourages agencies to develop and implement wellness initiatives. So that's one, wellness initiatives, and convene wellness committees regarding all the dimensions of wellness, including emotional, environmental, financial, intellectual, occupational, physical, social, and spiritual. Pretty comprehensive about addressing those issues. And I want to talk now about approaches, and especially approach one about needing solutions that are top-down and bottom-up. That's a very, very important point. If you take nothing out of this training today, please take the importance of, take away this, that solutions need to be both top-down and bottom-up. And what do I mean by that? Let me back up. Physicians have been doing a lot of studying of what they call burnout in doctors, medical doctors. And apparently they have also a high suicide rate, but a lot of disengagement, a lot of exhaustion, burnout, disengagement emotionally from their job. And from what I've seen in the studies, it's kind of epidemic proportions. And so they have done several studies about how do we lessen this. And they found that both top-down organizational interventions help and bottom-up. And the bottom-up intervention might be training people in mindfulness practices, breathing exercises, resilience building tools along these lines that individuals can implement. So bottom-up is what the individual can go do maybe after work or during work time, ways to process something, cognitive reframes, whatever they do to think things through and soothe themselves when agitated, that kind of thing. So that's bottom up. The top down is strategies that are put in place by the agency. Let's say for the physicians, it would be by their let's say the hospital where they work. And they found that these helped. And these, for physicians, for example, strategies were getting them scribes so they can keep up with the electronic entry of all their reports after they see a patient. It was changing their schedule so they would get less hours back to back and a little more time to sleep. Their shifts would not be as long and they would have more time off. And the interesting thing to me is that they found that when they compared the top down and the bottom up, guess which was a stronger influence? The top down. Because with a top down approach, if you can take care of a problem before it happens or you lessen it, then people have to do less work to overcome its adverse effects. So if people, let's say, were given scribes to enter all their data and their notes instead of them typing them up, and they had more time away to go home and sleep and be more rested, then they didn't have all kinds of effects of stress like due to sleeplessness or insufficient sleep deprivation or tension. So they didn't have to be fighting that battle on their own. So we need both bottom up and top down, but boy, we really need to look at the top down effects that we can, influences we can have, like an agency providing different types of resources. The whole thing of staffing, of course, always comes up. the whole thing of response to critical incidents, etc. And we'll go over those a little bit later too. And then a second approach would be doing both prevention and recovery. And we mentioned that earlier. We need to have preventative things like the toolbox and the hazmat suit, where people are prepared and ready from the training academy. People need to get vaccinated and equipped that this is going to be a different type of job. And then recovery for those who have been affected significantly, how to bounce back, how to heal, how to recover. And we want it to be for all job types, not just security staff and custody, because the other program staff and other staff are affected also, and they all work together ultimately. And it has to be diverse in terms of what we're trying to do, because one thing will not fit everybody. So there has to be a diversity of approaches, because some people might like a breathing exercise, mindfulness kind of thing, and they connect with that, but others will not at all. But they will connect with the program on physical, working out or healthy eating or something of that nature. And we want to have as goals building awareness without scaring people, just awareness, matter of fact, that this is an abnormal, they'll be having what people call abnormal experiences, but in corrections they're normal. And so we need to build awareness, and then we need to be equipping people what to do with that awareness, what to do now they know that the job affects them, then what can I do? And we want to be skills-based, not theoretical and abstract, but skills-based, like a cookbook, 1, 2, 3 exercises for dealing with, let's say, if you start feeling massively anxious, or if you start having insomnia issues, or whatever it might be, conflict with coworkers, conflict with offenders, skills-based behaviors that are concrete, and having resources, a multitude of resources that staff can access. And since it's a 24/7 job, really resources ideally should be as much as possible 24/7, such as EAP lines being available, phone lines after hours, not just during 8 to 5. And we want to be able to evaluate. We want to evaluate the solutions that are being implemented. So one has to have some kind of study of the impact, and both in a quantitative way, like measuring maybe means and averages and percentages of people having, reporting certain things or functioning in certain ways, but also qualitative, where we ask questions and sit down with people and talk to them about their experiences. And that's a particular type, very specialized type of research with qualitative data that are people telling you what it's like for them. And ACA commits itself to supporting and improving the overall wellness of correctional employees. And that to me is beautiful. It's music to my ears. It needs to be in the forefront, because one thing that we know, and also the physician study shows it, that when staff are not well and they're not functioning well, they are not going to be able to do their job well, and therefore the whole mission of the organization regarding offenders is going to be impacted negatively. Like there'll be more mistakes made, there'll be poor judgment acted upon, there'll be errors of omission and commission. There would be more incidents that could have been avoided if people were functioning well. And therefore, staff wellness is, to me, absolutely necessary for an organization to run efficiently and effectively and to meet its mission. And it has to be a mindset of a marathon, not, okay, we did this, we taught this class back in 2015 one time, and they're good to go now for the next 20 years. That's only in the movies. People need repetition and exposure to things over and over and over again, and they have to take different steps at different times. So the attitude and the outlook has to be that this is a marathon. This is not a sprint. This is a long-term investment. This is a forever investment. As long as there are corrections, really, we need to be learning and working and trying to improve the conditions for the staff and how to help them get through. They're extremely demanding and challenging jobs. So it has to be a marathon perspective that we're in for the duration, and every step in the right direction counts. And we have to keep taking those steps. And maybe sometimes it'll be a mistake, and like back up, like, oh, this did not work. This did not produce the results we thought it would. Back up and start over. Think it through some more. Bring in people that are experts in that area and think about how to do it better, and learn from our mistakes and keep going. So to wrap it up, we know from research that the effects of the occupational stressors in corrections work affect the staff's health and functioning it can be in very severe ways. And after the individual is affected, eventually the organization is affected. So it starts malfunctioning, and we cannot afford to do that. And then combining organizational, top-down, and individual, bottom-up initiatives to counter those stressors is the ideal recipe. So the organization needs to do what it can do, like provide resources, provide the staffing, provide the training, provide whatever else they can provide to staff and their families. And then the individuals need to take those tools and apply them and start doing them at work and at home. And that's when we would have the most promising outcomes. So, so that is my 2 cents worth for today. So I want to thank you for joining us, and I want to let you know that here are references at the end, and from physician studies. And thank you. So what do we have as far as any questions?
Caterina, there's a question in the chat box from Bernie about involving everybody in a multi-level approach.
In looking to so it needs to be multi-level, everyone involved. Well, it depends on what we're yeah. Thanks, Bernie. Yeah, you know what? It's like, okay, to answer the first question, there is a comment after that. It depends on what one is trying to do. Maybe they will start with maybe the security staff only, but at some point everybody needs to be involved. Like I said, the nurses, the teachers, if that's what she was asking about. Ideally, yes, everybody, because they're in the same pressure cooker day in, day out. They're part of the team. The other folks are part of the team also, and they're affected just as much. And I mean, when we do our exercise, which is anonymous exercise, you could not tell who's an officer, who's a teacher, who's an administrator. They're all writing things down about how they're affected. They could have been writing each other's cards about. So I'm saying, ideally, yes, you cannot just say it's COs only that, or probation agents, or parole agents only. No, even their clerical staff that types up those investigations, the clerical staff that, or classification staff that read the files, they're affected also. And yes, there was another comment there earlier by Bernie that some people said that it would raise the liability of the organization to look at corrections fatigue. And the truth of the matter is that, in my opinion, that there's so much evidence that these are real issues that I think an agency would be more liable if they ignored what's very proven at this point from studies. I mean, we've done some studies at Desert Waters. Folks in Connecticut have done studies. They're all over. There are way too many to be talking about right now in detail. But there's so much information about those issues that if we ignore them, then it is like deliberate indifference. because the issues are, and you have all those suicides, they're undisputable, and therefore being proactive and trying the best one can, starting somewhere, is the wise thing to do, and the compassionate and humane thing to do, and the right thing to do. And really, if they otherwise will have the same results of people quitting, people malfunctioning, people making poor decisions, and ending up with the agency with a lawsuit for excessive use of force. So that's my opinion. That really, it's time. One cannot ignore it anymore. And as far as do I have any input about the people are short and angry? I mean, yeah, sitting down and talking with them first, and then, of course, recommending resources like maybe talking to somebody and working through some stuff, but really trying to see, is there an issue, a personnel issue where they have a clash with a coworker or a supervisor, and trying to find some solutions. Is it that they're having issues at home? Is it that they're so incredibly tired from a lot of overtime that they're exhausted? I mean, across the country, there are people doing overtime 3 and 4 and 5 times a week, pulling doubles, and sleeping 3 and 4 hours a night or a day for months and years on end, and they are at their wit's end. I mean, they cannot think straight. They are exhausted, and we see that across the country, and the people who keep showing up to work, of course, they get more burned out because they're doing the doubles and other people are not there, so they'll be the ones who will get ill or quit. Or they fall ill and then they're gone for a long period of time themselves, and somebody else bears the brunt. So we need to step in and do whatever we can to stop that vicious cycle from perpetuating itself, where the people who show up get burned out more. So again, these are my impressions, but we've seen that, like I said, across the country. It's not one agency. People lose their staff sometimes faster than they can get them in at the training academy. Always trying to catch up, and it's sad because so are there any other questions?
Caterina?
Yes.
Hi, Gary Cornelius calling. Great presentation.
Are you just done? Are we done? We're done. Are we all, can you hear us?
Yes, I can.
Okay. So what's up?
Oh, nothing. I'm teaching stress management. I'll definitely use some of this and give you credit. The supervisors part, yeah, the supervisors I know, they recognize the problems in the jails and the head lawsuits off and problems off. They know that they have problem staff that they have to deal with the stress.
Yes, and it's sad because I mean, people were not in that place when they started. They kind of got there over time, that cumulative effect, and they really need some help. Otherwise, you lose those people one way or another. Either they stay and they don't function, or they are gone.
That is true. That is true. But it was good job. I really enjoyed it. Thank you.
Thank you, Gary. Thanks for your encouraging words. So
Caterina, there's a new question in the chat box.
Bernie, you're so good with your questions. What 3 most important things a supervisor can do for their staff? Okay, so from what we hear across the country, being present, being approachable, available to answer questions, to mentor, to correct without slamming them, without humiliating them, for example, constructive criticism kind of thing, correction. Being available, being supportive, being encouraging, the thank yous, the encouraging from, learning from mistakes. So in a way, I mean, talk about a tough culture in corrections. We're talking about people being nurturing and being emotionally available. And that's kind of like not the language that correction staff are used to talking in, but they need to be encouraging and supporting and shaping their people, because they don't learn it all at the training academy. They are continuously learning, and backing them up, and acknowledging the fact people are exhausted, for example, if they are. Acknowledging, validating, opposed to arguing.
Caterina?
Yes.
Yeah, I think one thing is, Gary here again, is for the supervisors not to forget where they came from.
Right.
I think some of them, they make rank, they get comfortable, and they kind of forget what it was like to work the floors. And secondly, if I had a wish list for a perfect world, I'd like to see stress management being offered as a basic at the academies, at the recruit level.
Oh, absolutely, and we start doing that. Actually, we have one of our courses, the Correctional Fatigue to Fulfillment course. We have a version now for the training academy that some agencies have started using. You need to vaccinate them. You need to get them some hands-on, scenarios and stuff to really think about what they're getting into, so to reduce the shock factor when things happen. But yeah, and the whole thing of, I think, forgetting where they're coming from. I think that supervisors have so many stressors of their own that maybe they're spent and running on empty, and so they don't have a lot sometimes, unless they have really good self-care skills going on. They don't have much left over to give to their staff, because they're barely hanging on sometimes, because they are learning their job and they have to put up with pressures from somebody else themselves, and so they are, like I said, barely taking care of their own survival. So they are not particularly, at times, not always, nurturing and shaping and mentoring their own subordinates. And and again, there are exceptional supervisors out there, very, very good and encouraging and pulling the team together. And then we have people who are themselves wounded and they really are not functioning well along these lines. And they need help. It's not about criticizing. It's about acknowledging the awareness and then saying, okay, how can we be there for you? How can we help you? How ideas to get them to open up and engage again? Well, I think to open up, you have to lead the way. I think nobody's going to open up unless somebody else leads the way. Maybe somebody with a higher rank makes themselves more vulnerable, gets more real, talks about their own struggles, talks about their own ways of coping, and normalizes things, as opposed to acting like you're the weak one who broke and we're fine. So the staff need to have somebody model to them what it means, to what it looks like to be real and open and engaging, and then provide opportunities here and there, either through a training, a team building exercise, a family day event, or something, for people to do those things. Many little exercises as a team during shift, all kinds of things of that nature, but somebody has to be modeling it and repeatedly, because at first people will be very skeptical and cynical and will not come out from behind their wall. And providing literature to them. We have that free publication every month, the Correctional Aces. You can forward that to them and start kind of taking walls down when they realize that they're not the only one having certain challenges and struggles. And it's a free publication, by the way. You can get it on our website too. So all that is kind of increasing the awareness and giving some solutions. Anybody else? Michael, are you there?
No. Yes, you had one more question just come up from New York City.
How do you effectively handle safety when leadership is ineffective? Okay, can I see the beginning of that question? Can I see the beginning of it? Can I scroll up? Let's see. Yeah, there it is. Oh, that's a long one. Whoa. Okay, hang on. Wow. Wow. So that is I mean, that's way beyond the wellness. I mean, that affects wellness incredibly when the staff feel like they're not backed up, or we've been told over the years of people who write up a report and it gets shredded, and they're told don't create work for me. I mean, this is, we've heard that many a time. And so they feel like they have no way to hold people accountable. I mean, inmates accountable. Wow. And I think if people stay in that job, in that work environment, they will have to do a lot of bottom-up kind of coping, and maybe create and keep their own documentation. And I know of people who have done that for years. They kept their own documentation on their computers at home, dates and everything required in case something was needed, to have that backup. And I would say that I'm not a lawyer, but I would say that will not hurt, to have your own documentation, and then do whatever you can to have a life outside of work and to have a good, strong team, and not be consumed by the bitterness and anger, because it will only hurt us in the end ourselves. So, and I know some people who have left places like that, and a good friend of mine always likes to say, people do not leave the job, people leave their supervisor. So some people might leave a place like that and go somewhere else, if they can. Thank you. Thank you. Thank you, guys. Thank you for being here. Thanks for caring. Thanks for caring. A lot of people need you, and I love that little doggy in the background. Thank you.
That's my Scotty.
All right. Hi there, boy or girl, whatever it is. Very good. Thanks for putting a smile on my face, and let's keep on going.
Thank you.
Thank you.
Good job, Caterina. I'll follow up with an email to everybody with an evaluation for the webinar.
Thank you. Thank you. We made it okay for time, right?
Yes.
Very good. Thank you. Take care. Thanks for having me.
Thanks, everybody.
Thanks, Mike.
Bye-bye. Bye.
Thank you, Mike.